Good afternoon. Today is Good Friday, and this Sunday, millions of Christians celebrate Easter and the resurrection of Jesus Christ. At this holy time, we pray that God will heal the sick and comfort the heartbroken and bless our heroes. As American families look forward to Easter, we're reminded that our story ends not in despair, but in triumph and renewal. Very appropriate, isn't it? I'd like to provide Americans an update on our ongoing efforts in the war against the invisible enemy. Before I do that, I'll have a couple of notes. The United States, in discussions last night with Mexico, Saudi Arabia, Russia, and in dealing with OPEC nations, we are trying to get Mexico, as the expression goes, over the barrel. And Mexico is committing to do 100,000 fewer barrels. The president and I spoke last night. We have a great relationship, great friendship. They're helping us very much at the border. They have 27,000 soldiers, Mexican soldiers, on our border right now, stopping people from coming into our country as our wall goes up. We're up to about 168 miles of wall. And in speaking with the president, they have a limit. The OPEC nations have agreed to a different limit, reduction of about 23%. So what I thought I would do, and I don't know that it's going to be accepted, we'll find out. The United States will help Mexico along, and they'll reimburse us sometime at a later date when they're prepared to do so. And we had a great conversation, but we'll find out how that all works out. As you know, they're trying to get rid of the glut of oil. There's a tremendous glut of oil, and we don't want anything to hurt our incredible industry. We're actually the largest producer in the world now, so we don't want anything to hurt those jobs, those great jobs in Texas and North Dakota and Oklahoma and everywhere. We have a tremendous energy, New Mexico, tremendous energy business, and we want to keep those jobs. So we're working on it. I think eventually it's going to work out. May work out quicker than what most people thought possible, and maybe it won't, but it'll work out eventually. Our experts are monitoring the data from every part of our country having to do with the topic that we're here to discuss. In the midst of grief and pain, we're seeing clear signs that our aggressive strategy is saving countless lives. Tremendous progress is being made, although when you look at some of the numbers, I just spoke with Governor Cuomo, we had a good talk. When you look at those numbers, the numbers of death, people that have died, it's so horrible. Now, on the other side, you have the numbers of beds being used, we were just saying, are substantially reduced. That's usually the sign that it's heading in the downward curve. So New York, we know where that is. But in the midst of all this grief and this pain, we're seeing these signs, and we're seeing them very strongly. And a lot of that has to do with the aggressive strategy in saving so many lives. We're saving so many lives compared to what it could have been. So nobody knows what the number is, but we had a number of 100,000 lives. As many as that is, it's impossible to even think of it. And that was the low end, with a tremendous amount of work and a tremendous amount of, you can call it many different things. Our people had to be extremely strong and brave to be able to put up with what they've put up with. But the minimum, if you did this, social distancing, and every other aspect, and I think I can say 90%, maybe even more than that, we're able to do it. The minimum number was 100,000 lives, and I think we'll be substantially under that number. Hard to believe that if you had 60,000, you can never be happy, but that's a lot fewer than we were originally told and thinking. So they said between 100 and 220,000 lives on the minimum side, and then up to 2.2 million lives if we didn't do anything. But it showed just tremendous resolve. by the people of this country. So we'll see what it ends up being, but it looks like we're headed to a number substantially below the 100,000. That would be the low mark. And I hope that bears out. The situation in Detroit and New Orleans appears to be stabilizing. Detroit is really started to go up, and now it is stabilizing. And New Orleans is a great place. I have so many friends there. They can't believe what's happening, but it's really stabilized. I spoke with the governor of Louisiana, and as you know, we're building them additional beds right now, the Army Corps of Engineers and FEMA. And that is going to be done, and I hope they're not going to be very well used, because I think they've really, I don't think they're going to need them, or certainly not very many of them. We built them a big hospital of 1,000 beds, and now we're in the midst of doing another 1,000. I don't think they're going to be using very many of them, and that's a good thing. There was a time 2 weeks ago when we said that's not going to be nearly enough. We're going to have to build more, but we wanted to wait to see, and I'm glad we waited. It just looks like they're doing really well. Louisiana and state of Michigan is doing really much better than we thought. In Washington State, we've made enough progress that the governor is now able to return an Army field hospital, so we're going to take that hospital. We don't think we need any more hospitals. We've built thousands of beds all over the country, and we think we're probably not going to need that hospital anywhere. If we do, we're ready to move it to a different location. In New York, we're seeing hospital admissions declining very substantially, as I said, and nationwide the number of new cases per day is flattening substantially, suggesting that we're near the peak and our comprehensive strategy is working. Over time, our guidelines to slow the spread are decreasing the rate of new cases very substantially, and will result in fewer hospital admissions, and we're seeing that. It's incredible. I think with no exceptions, it's looking like it's lower. And again, that's because of the people doing what they had to do, great people, and working with elected representatives and the doctors, the nurses, and everybody. I mean, just everybody. Everybody so has been so amazing. I was told this morning again, please mention all of those people working in the grocery stores, and it's true. The checkouts and the clerks and the people that are really, and a number of those people have become infected. So we want to thank them and a shout out to them. With the tireless devotion of American doctors and nurses and all of the medical people, we've kept our fatality rate very, very low compared to other countries. My administration's closely monitoring the data on the virus's impact on our cherished African American communities, because they've been hit hard. And the Surgeon General will be sharing more of that information right after we're finished here. He'll be coming up and saying exactly what's happening, because it's really, it's very troublesome, I will tell you that. I'd also like to provide clarity on the important point for many Americans on elective surgeries. While we've asked hospitals to cancel surgeries and procedures that do not take place at this time, just not to do them now, the choice to delay any treatment still remains between the patient and their doctor. We're not advising Americans to postpone medical treatment that their doctor believes should occur now. So it's different kinds of surgery, obviously. But we're really getting to the point where you can start to think about doing that surgery, if necessary, pretty soon, I think, pretty soon. Yesterday, I directed Secretary of Agriculture Sonny Perdue to expedite aid to American farmers. And Secretary Perdue will be using all of the tools at his disposal to develop a program, and very quickly, of at least $16 billion to provide relief for farmers, ranchers, and producers impacted by the coronavirus. In this time of crisis, we must keep our supply chains moving from the beginning, right from beginning to end, and we're committed to supporting the amazing men and women who produce supply. I did last night a statement on social media, and I said, I have directed Secretary Sonny Perdue to expedite help to our farmers, especially to the smaller farmers who are very, very badly hurting right now. I expect Secretary Perdue to use all of the funds and authorities at his disposal to make sure that our food supply is stable and safe, and our great farmers are prosperous and continue to be prosperous. We're working very hard to make sure our food supply chain is sound and plentiful, but we all know that that begins with our farmers, cattlemen, ranchers, and producers. So we're going to be working with the small farmers, the big farmers, the cattlemen, the ranchers, all of the producers. We're going to take care of them. We're working with them right now. We have a lot of money that was put there through our use of tariffs and other means, and we're going to help out our farmers. And I don't think, I'll tell you, I've been helping our farmers for a couple of years because they were targeted, as you know, by China and others. And I think they're very grateful for what we've done. On the medical front, the FDA has issued 47 emergency use authorizations for advancements in testing, new ventilator designs, innovations in personal protective equipment, and experimental medicines, and Dr. Hahn's going to be talking about that. We've cut through the red tape to give doctors and patients unprecedented freedom to make their own healthcare decisions, granting access to potential therapies and drugs. Since Monday, we've deployed 2 major shipments of hydroxychloroquine from our national stockpile. It's going to various cities. And we are also disposing and getting, as quickly as we can, portions of it to the Department of Veterans Affairs and the Department of Defense. And speaking of the Department of Defense, they're going to be sending us 10 million N95 masks that they had. And we're in great shape in every way. We're in great shape with ventilators. We're in great shape with protective clothing. We have additional plane loads coming in, but we're not getting any calls from governors at this moment. I can speak, I think, for Vice President Pence, who'll be talking in a little while. We're getting very few calls from governors or anybody else needing anything. They're in great shape for this surge that's coming in certain areas in particular. And that's a good job. You've done a great job on that, Mike. Really a great job. I appreciate it. The whole country appreciates it. More than 2 million coronavirus tests have now been completed, and we're conducting approximately 100,000 more every day. We're also working to bring blood-based serology tests to the market as quickly as possible so that Americans can determine whether or not they have already had the virus and potentially have immunity. They have immunity if they've had the virus. A lot of them don't even know if they've had it. Sometimes it's brutal. You see the Prime Minister, who seems to be doing well now, I hope. He had a rough go of it and still is, but he's doing better. And then some people don't even know they had it. It could be sniffles. It could be they don't feel perfect, but they've had it. And they're the lucky ones. The NIH, CDC, and FDA are currently validating these antibody tests to ensure that they're accurate, and they're doing that at breakneck speed. I think we can say that, Doctor, and we're going to get them approved very quickly. Dr. Hahn. When validated, we're confident that the production will scale up to tens of millions of tests very quickly. We're leading the world now in testing by far, and we're going to keep it that way. Other countries are coming to us, and they're wanting to know about our tests, and can they buy the tests, and can they do whatever they have to do to get the tests, and we're going to make that very soon. We'll be in a position to make that possible because it's important for them to have it. And we're going to have an announcement on the World Health Organization sometime next week. As you know, we give them approximately $500 million a year. And we're going to be talking about that subject next week. We'll have a lot to say about it. We'll hold it. Every American should be proud of what our country has achieved in just a short period of time. The U.S. military has deployed thousands of personnel to build 23 temporary hospitals with more than 16,000 beds. And we have the potential to build many more if we needed them. We're all ready to go, but I don't think we're going to need them, which is great news. And we built those hospitals in 12 states, and the District of Columbia using the Defense Production Act, and we used it like a hammer. A lot of the media said, oh, we weren't using it. We used it like a hammer to a point where all we had to do is say the words and everybody gave us max, and they've done a good job. They really have done a good job with few exceptions. And we've harnessed the full power of American industry to produce ventilators and other essential supplies. Right now, we're making thousands of ventilators, many of which we won't need, but we'll use them in our stockpile. And we'll build that up. We'll also help build up the stockpiles, which they should have had in the states. And so we're working with governors on that. And we'll also help other countries. There are countries that are calling us for help. They need ventilators, and they're in no position to build ventilators. We are. We have Ford and General Motors, and many companies are building ventilators. So we're going to be helping at a not too distant point. We're going to be helping quite a few of the countries. Now, we've launched Project Airbridge to deliver nearly 300 million pieces of personal protective equipment from and around the globe. We're also shipping out 60 sterilization systems to 10 different cities that can each sterilize up to 80,000 masks each day, and I'm even hearing it can go up to 120,000 masks a day, certain equipment with certain additions. It's a company in Ohio that makes it. It's a great company, great. I hear it's a great product, works very well. I asked that question. I said, how come we have to buy so many masks? Why can't we sterilize the masks that are being used? And the answer was you can. In this case, they say up to 20 times. So we can take a mask, certain types of masks, the N95s in particular, and we can sterilize them, make them very clean up to 20 times. That's a great thing. In addition, we passed the largest emergency economic relief package in American history to save the U.S. economy and protect the American worker. As you know, this past week, which was 4 active days on the stock market, Good Friday today is not included. The markets are closed. In 4 days, we had the biggest stock market increase that we've had in 50 years. That tells you that there's a pent-up demand. That tells you they want to get back. There's something good going to happen. I really believe that. There's something very good going to happen. We have to get back. So think of it in this horrible period, this horrible, dark period where this monster came and worked its horrible, horrible spell over the world. 184 countries as of this morning. 184 countries. We've done well, and I guess the market thinks we've done well because we had the biggest stock market increase without one day. We're talking 4 days instead of 5 that we've had in 50 years. 50 years. Think of that. More than 50 years, actually. In short, the American people have launched the greatest mobilization of our society since World War II, deploying every scientific, governmental, medical, and military resource to defeat the virus. So I want to just start then with, we're going to answer questions later. We'll have time. I think we have a lot of time today. A lot of people are off, as they should be, Good Friday. So I'll stick around. We'll answer questions later. I want to start with Deborah Birx, please, Dr. Birx, and you can go over some of the numbers we just looked at, and that'd be great. Thank you very much, Deborah.
Thank you, Mr. President.